Hello. Today's topic of discussion will be assessment of physical growth. Assessing physical growth involves evaluating an individual's growth patterns in relation to standardized norms. This is essential for identifying growth abnormalities, nutritional status, and overall health of a child. And the assessment of physical growth includes the body measurements, that is the anthropometric measurements, taking weight, length or height, head circumference and chest circumference, and checking the velocity of growth, checking eruption of teeth or the dental age, and assessment of bone age. Starting with anthropometric measurements with measurement of weight. Weight is a very sensitive index in a child because whenever a child gets ill, becomes sick, significantly there is a weight loss. Whereas for height, it takes a long time. For any illness, if there is a malnutrition, it takes a long time for height to be affected. But weight is very easily affected. So this is a very sensitive index. So we start with different ways to measure weight at different age, and we'll also check the velocity of weight. In a normal newborn infant, if we see the physical growth, at birth, the normal weight of a newborn is ranging from 2500 grams to 4000 grams. After that, there is a loss of weight of around 5 to 10% by 3 to 4 days after birth. All the retained fluid is losing, so the baby loses weight. After that, there is regain of weight by 10 days in case of term baby and by 14 days in case of preterm baby. So by 10 days, a term newborn comes to the birth weight, and preterms by 14 days it comes back to its birth weight. After that, till 3-month age, the gain of weight should be 25 to 30 gram per day. Then 3 months to 9 months, a baby gains 400 grams per month. And from 9 months to 12 months, a baby gains 300 grams per month. And then we use different formulas to calculate weight. From 3 months to 12 months, the weight is calculated by formula age in month plus 9 divided by 2. 1 year to 6 years, the formula you can use is age in years into 2 plus 8, or age in years plus 4 into 2. Then after 7 years till 12 years, age in year into 7 minus 5 divide by 2. Different formulas to take out weight. And if you see, a baby doubles the birth weight by 5 months. Suppose 3 kg is the birth weight, by 5 months this baby should become 6 kg. So similarly, triples birth weight by 1 year. The birth weight becomes 4 times by 2 years. It becomes 5 times by 3 years. And in general, if you see, there is a gain of weight 2 kg per year till 6 years of age. So 1 year a child should be 10 kg, 2 years 14, 3 years 16, 18, that way. So after that, after 7 years till puberty, the gain of weight is 3 kg per year. So a 7-year-old child should be weighing 7 into 3, 21 kg. Suppose the child is 10 years, then 10 into 3, 30 kg. So that way, gain of weight is 3 kg per year. This is an electronic baby scales which is used in NICU. neonatal intensive care unit is NICU. So here the electronic baby scales are used to weigh weight of the baby. Infant baby scales used in outpatient department or even in the wards you can use this. Then comes the bathroom scale. So this is used in mobile clinics, so you can carry this weighing scale anywhere you move. So this is used in mobile clinics and even in the wards and OPDs. This scale is used. This is known as bathroom scale. So more than 6-year-old child, the weight is taken by this bathroom scale. And in mobile clinics you can even use Salter spring balance. So maximum it weighs is 25 kg, and less than 6-year-old children can be, for less than 6-year-old children the weight can be taken in this balance. Now come to length or height. Length, when you take a supine lying height, that is known as length, and when you take a standing height, that is known as height. So length is taken till for babies till they can stand still. So less than 2 years, all the children we take a supine length, and then above 2 years we take a height, standing height. At birth, the average length of a baby is estimated to be 50 centimeter. Then the velocity of length is, first year of life a child grows 25 centimeter per year. So if the birth weight length is 50 centimeter, 1 year plus 25 if you do, it becomes 75 centimeter. So this baby should be 75 centimeter by 1 year. And second year of life they gain 12.5 centimeter per year. Third year of life they gain 7.5 to 10 centimeter per year. And the third year till puberty the length is static, or the height is static. They grow only 5 centimeter per year. So during this period many parents they come to you with the complaint of child not gaining height. But actually you should be seeing the whole year velocity of height, and if the child is growing 5 centimeter per year, that is normal. Then at puberty suddenly there is a gain of 11 centimeter height. So that is a height, the length spurt or the height spurt is their growth spurt because of the changes in the hormones. The formula we use for height or length is 1 year a child is 75 centimeter. Then after 2 years to 12 years, the formula is age in years into 6 plus 77. Techniques to measure the length. So less than 2 years we said we'll take a supine length. The baby is lying supine. So this instrument is known as infantometer, where you can see there is a board with the two ends. One is head end which is fixed, and the another lower part is the foot end. So foot end is mobile here. So you can move the foot end up and down and to take the exact length like this. So baby is lying like this with the head touching the head end, and the foot end that is mobile. You can push this up down to take the exact length of this baby. Then standing height after 2 years of age, once the child is standing stable, we take a standing height, and the instrument we take height is known as stadiometer. In the stadiometer, foot end is fixed and the head end is mobile, just the opposite of the infantometer. So here a child, if you don't have a stadiometer, then you can just put a measuring tape against the wall and then take the height in this way. So without the footwear, a child should stand with heels and back touching the wall, looking straight ahead along the Frankfurt plane. Frankfurt plane is a line, imaginary line, which passes through the inferior margin of the orbit and external auditory meatus. So along this line, the child looks straight with the back heels touching against the wall. Then the right angle block slides down until it touches the head. If it is a stadiometer also, you are going to move that head end, bring it down until it touches the head. So here also, if you do with the inch tape, the right angle block slides down until it touches the head, and then you record to the last 0.1 centimeter to get an accurate height. So this is a stadiometer. Child is standing still, foot end is fixed, whereas the head end is mobile. You can move the head end up and down until it touches the head of the child. Now, prediction of adult height can be done in children by using Tanner's formula or by taking out mid-parental height. There are many other ways, but these are the two main methods frequently used. So Tanner's formula says a height at 2 years into 2. So height of a child at 2 years of age, if you multiply by 2, that will be the adult height of that child. And you can take out the mid-parental height by using, mid-parental height by using formulas. So for boys, formula is father's height in centimeter, then you take mother's height in centimeter plus 13 and divide by 2. So whatever comes out, that will be the mid-parental height for that child, that son. If it is a female child, then father's height in centimeter plus mother's height in centimeter minus 13 and divided by 2. So target height of the child will be plus minus 8 centimeter. Then taking the head circumference, measuring the head circumference, also known as occipitofrontal circumference. To take a head circumference, you need non-stretchable tape so that the measurement is accurate. And you do cross tape method from supraorbital ridge in front to occipital prominence behind the head. And you apply a firm pressure and then do a cross tape method so that you compress the hair and you get the accurate measurement. Now, the velocity of head growth. At birth, average circumference considered is 35 centimeter. Then, first 3 months of life, there is a gain of plus 2 centimeter per month. So, if it is 35 centimeter at birth, then by 3 months, 2, 4, 6 centimeter gives you 41 centimeter. So, after 3 months till 6 months, there is a gain of plus 1 centimeter per month. Then next 6 months to 12 months, the gain is 0.5 centimeter per month. After that, 1 to 2 years, there is plus 2 centimeter gain. Then 3 to 5 years of age, there is just 1 centimeter gain per year. Then by 12 centimeter, in average, head circumference becomes 52 centimeter. But it can range from 52, 54 like that. It can range, but average is 52 centimeter. Then, if the head circumference is growing more than 1 centimeter in 2 weeks interval duration during the first 3 months, then you have to suspect this child might have hydrocephalus. Measurement of chest circumference. At birth, head circumference is 3 centimeter more than chest circumference. First year of life, head circumference is equal to chest circumference. Then more than 1 year, chest circumference becomes more than the head circumference. Again, measurement is done by non-stretchable and tape by cross tape method. It is measured at the level of the nipple midway between inspiration and expiration, but it should not be over the clothing like you see in the picture. It should be without the clothings when you take a chest circumference so that you get an accurate measurement. Another parameter to assess growth is bone age. First bone to ossify are clavicle, mandible, membranous bones of the skull, and ossification between 50 days to 5 months of gestation, the ossification starts. So at birth, if you see, the bones that is ossified are distal end of femur, proximal end of tibia, head of humerus, cuboid, talus, calcaneus. This is important because when you send a baby for X-ray, you have to decide which part of the body you're going to order for X-ray. So if you know the ossification center at what age, then you can select the part of the body accordingly. So newborn, if you want to see the bone age, then say do X-ray knee plus foot. 3 month to 9 month age, X-ray of the shoulder and wrist is done. 1 year to 13 years, X-ray of the wrist is done. 8 to 12 years, distal ulnar epiphysis. So you can do the X-ray of the hand, arm, forearm, and then 12 to 16 years, elbow, distal end of ulna, hip, and iliac crest. So you can select the different part of the body accordingly. Okay, carpal centers, when it is going to ossify. So carpal centers, there are 8 carpal centers: capitate, hamate, triquetral, lunate, trapezium, trapezoid, navicular, or also known as scaphoid, and pisiform bone. A distal epiphysis of the radius ossifies before the triquetrum, and that of the ulna before the pisiform. So this end of the X-ray hand is chosen for a long time. The carpal centers appear by 2 months of age, and there is 2 carpal centers by 1 year of age. Then after that, 1 center appears each year. So age in years plus 1 will be the formula. 1 year there are 2 carpal centers. 2 years there will be 3 carpal centers. 3 years 4 carpal centers, that way. So age in years plus 1 you can do. Then pisiform bone ossifies at 11 to 12 years of age. Then dentition, or the dental growth eruption, also gives you a hint regarding the growth. Eruption of teeth starts by 5 to 6 months of age, and the first teeth that comes is known as milky teeth or deciduous teeth or even temporary teeth. Formula for dentition will be deciduous teeth 2102 is the formula. This deciduous teeth, there are 2 incisors, 1 canine, no premolars and 2 molars. So 2 to 4 plus 1 is 5. So 5 in the upper jaw, 5 in the lower jaw. 10 in the upper jaw and 10 in the lower jaw. So there are 2 sets. And then permanent teeth 2, 1, 2, 3 is the formula. They have 2 incisors, 1 canine, 2 premolars and 3 molars. So 3, 2 is 5, 6, 7, 8. 8, 8, 16, 16, 32. 16 in the upper jaw, 16 in the lower jaw. So deciduous teeth 20 in number, and then permanent teeth 32 in number. The age of dentition in the maxillary and then mandibular. Upper jaw is maxillary, lower jaw is mandible. So central incisor, usually lower jaw, the eruptions of the teeth is earlier. So central incisor 6.5 month in mandibular, maxillary 7.5 month. Lateral incisor 7 month in mandibular, 9 month in maxillary. Canine 16 month in mandibular, 18 month in maxillary. And there are no premolars. First molar 12 month in mandibular, 14 month in maxillary. And then second molar 20 month in mandibular and 24 month in maxillary. So this way all the lower jaw eruption of teeth is before the upper jaw. And permanent teeth, after excision of the teeth, the permanent teeth comes. So central incisor, mandibular 6 to 7 years, maxillary 7 to 8 years, lateral incisor 7 to 8 years, and then maxillary 8 to 9 years, canine 9 to 10 years, and canine 11 to 12 years. But the permanent teeth for both upper and lower jaw, for premolars and molar, is occurring at the almost similar age. So first premolar is appearing at around 10 to 11 years, second premolar erupts at around 11 to 12 years, and first molar 6 to 7 years, second molar 12 to 13 years, third molar 13 to 17 years. That is the usual age. Sometimes third molar may be even later, and in some it may never erupt. Okay, thank you. Next class I'll continue with development.